Bulawinaka, Fiji, we've seen week over week increases in our 7-day rolling average of cases, with another 1,091 new cases confirmed in the past 24 hours. While the current outbreak is contained to Vitilevu and primarily in the Lami to Nosori corridor, over the last week, we are also seeing increasing number of cases in the Western Division. We have 21 new COVID deaths from the period of the 4th of July until the 20th of July, 14th of July to the 20th of July. 2 of the deaths confirmed today were pregnant women. Both women had been unwell with COVID symptoms at home before presenting to our health facilities in severe respiratory distress. In both cases, our physicians made the decision to conduct emergency cesarean sections to rescue the newborns and assist with the care of the mothers. Sadly, despite the best efforts of the attending physicians, both mothers passed away. However, the fast actions of the obstetric team saved both the babies. Maternal deaths at any time are a tragedy, and maternal deaths due to COVID-19. This is a clear indication of the severity of this outbreak. Given the rapidly evolving situation, our teams have been working around the clock to reprioritize and focus our efforts to ensure that we are protecting those most at risk of severe COVID-19 and dying, and that is our elderly, people with existing medical conditions, and pregnant women. These shifts include changes in our testing services, home quarantine guidance, ensuring that we are providing life-saving medical care to those women who are most at risk, and establishing vaccination for pregnant women. But we need your cooperation, because saving lives from COVID-19 depends on your adherence to the rules and your understanding as much as ever. I know some people have been experiencing delays in being swabbed and receiving their test results. At the national level, our testing is averaging about 4.3 tests per 1,000 population per day. And in the Suvarnosari corridor, we have 6 per 1,000 population per day. At a population level, we are testing at similar rates to be like you find in developed countries like in Australia, especially in the state of New South Wales, which also has an outbreak. And we are doing this with just 6 laboratories. We are working on increasing our testing capacity, including the establishment of a new Fiji CDC lab for Nandi in August. And we're developing a new web-based system for delivering test results to patients. But as cases have increased in the past 2 weeks, so has the demand for testing and for non-urgent samples. And this has affected our turnaround time. That has necessitated some important changes for the ministry. It requires new action from you, the members of the public. We need to target our testing to where the result makes a difference to the outcome of patients. That means we're now going to target our testing to those most at risk of developing severe COVID-19. And this is especially so for the Laminosori area. For community members who are at low risk of severe COVID, if you have been in contact with a person who has COVID or symptoms of COVID, for example, you live or work with someone who has COVID-19, you should assume you also have the virus. That means you immediately quarantine at home for the next 14 days. If you develop any COVID-19 symptoms during this 14-day period, such as cough, runny nose, sore throat, fever, loss of taste or smell, body ache and headache, you must almost certainly assume that you have COVID-19 and you should just self-isolate. Most people infected with COVID-19 will have only mild symptoms and fully recover at home. For lower risk individuals with COVID, that means the individuals who are young, they don't have any other disease with them, we ask you to please stay at home for 14 days. Isolate yourselves from other family members and continue to monitor your symptoms for severe COVID. If you develop any of the signs of severe COVID-19, like difficulty breathing or chest pain, then please go to one of your dedicated health facilities. For community members in the Laminosori area who are at high risk of COVID-19, we will be prioritizing the testing and the rapid turnaround for their results. If you or someone you are caring for has symptoms and is at high risk of severe COVID, in particular, individuals over 50 years, they have a chronic illness like diabetes, heart disease, kidney disease, asthma, or they're obese or are pregnant, we need you to get in touch right away and visit one of our screening clinics. If you test positive, then we will ensure you are provided immediate care by our health teams. Over the next few weeks, the overwhelming majority of COVID-19 deaths over the past few weeks, the overwhelming majority of COVID-19 deaths have been in our most vulnerable community members. When our health teams first saw these patients, most of them are either in a critical condition or have already passed away. If our health teams were able to see these patients earlier, we may have been able to save them. We know many families are valiantly trying to care for their loved ones at home. But for those who are most at risk of severe COVID-19, home care won't be enough. These individuals need their oxygen levels closely monitored. They likely need access to supplemental oxygen, as well as clinical teams to rapidly respond if their condition deteriorates. So please, if you or someone you're caring for has COVID-19 symptoms and are at high risk of severe COVID-19, please let us help you get the best chance of recovery. There is a video circulating online from within one of our field hospital locations. That facility was erected for the purpose of adding extra treatment capacity. And its conditions are exactly the same as field hospitals that we have relied upon in the past when we had major emergencies like cyclones and other disasters. We are now in the midst of a wave of COVID-19 infections. And like most countries around the world, we have to rapidly expand our health facilities by using these tents to care for COVID-19 patients and to ensure that those who need beds and access to ventilators can have them. Even in developed countries, similar measures have been taken. As an independent civil servant, I find it very disheartening that some people, including the media organizations, have sought to undermine this obvious and essential step to treat COVID-19 positive patients. Many people's lives have been saved in these temporary facilities, and we will continue to rely on their use until more Fijians are vaccinated. And as a direct result, the risks of severe disease and death due to COVID-19 in Fiji become much lower. We have 370 new recoveries to report today, with over 4,550 recoveries from the virus in total. Recovery is possible. In fact, most patients will recover. The sooner those most at risk are identified and treated, the more likely that they will be able to recover as well. Most of these recoveries will continue to come out of the field hospitals that we have set up. The data from today tells the same sobering story that we have seen since early May. We have an outbreak of severe disease and death among unvaccinated Fijians. Of the 144 lives we have lost to COVID in this outbreak, none were fully vaccinated, and 22 were partially vaccinated, having received only one dose, whilst the rest had no vaccination. There is no stronger evidence pointing to why we must vaccinate all adults, in particular those who are at greatest risk of severe disease and death. We need to do this as quickly as humanly possible. It is the best available protection against the worst effects of the virus. So again, I ask that anyone who is yet to be vaccinated, please do so immediately. To our younger ones, get vaccinated yourselves, and please help by bringing your parents, grandparents, and older community members to the nearest vaccination center or drive-through, and give them the best possible protection against this virus. On a positive note, as of today, 410,495 individuals, that's about 70% of the eligible population, have received at least one dose. And 83,732, which is more than 14%, are fully vaccinated. For those who are fully vaccinated, please remember that while you are offered very strong protection against severe disease and death, you can still get COVID-19 and you can pass it on to others, especially those who are not yet fully vaccinated. So please adhere closely to our other COVID-safe measures. For pregnant women and other high-risk individuals, we are also providing them access to Moderna vaccine. A person only needs to wait 28 days between the first and the second dose of Moderna vaccine. So this means we can protect them, we can protect those who are at high risk faster. To allow workplaces to reopen without crushing the capacity of our healthcare system, employees must be vaccinated. Social welfare recipients must be vaccinated as well. Even if the government has not mandated it for you, it is a mandate that you should make for yourself. It only takes one look at our rising number of fatalities to see there simply is no morally or medically acceptable alternative. Get vaccinated. Do it as soon as you can. And go further. Tell your friends and loved ones why you have been vaccinated and why they should also do the same. I know not everyone will be vaccinated just because I recommend it. Some people place their highest trust on those around them, those in their communities, those at the dinner table with them, those they have grown up with and they have known all their entire lives. By telling someone you love why you have been vaccinated and why they should too, you could be the voice that inspires them to be protected. You may well be better placed than any doctor to save their life and ease the strain of this outbreak on our healthcare system. So speak up. Sadly, many social media companies like Facebook, they just provide a platform for lies and misinformation about the vaccines. And they make sure that this misinformation spreads faster than the facts. So it is up to us to get the truth about the vaccine and the proven protection that they provide into the public domain and in front of those who need to hear the message most of all. In the meantime, we are continuing to target lockdowns in extremely high-risk areas, together with community engagement programs that will be where you see groups of our civil servants walking around some of those highly populated areas, engaging in community engagement activities. We are continuing to enforce the wearing of masks and the maintenance of physical distance. We are urging Fijians to stay home unless they have an essential reason to leave. And we are racing to vaccinate as many Fijians as we can. Do your part as well. Follow the rules and be vaccinated when you have the chance. We have a target of fully vaccinating at least 80% of all eligible adults in Fiji by the end of October. We can get there. We will get there. And Fiji will be much safer for it. Thank you.
Thank you and good evening. As the Permanent Secretary has just announced, we have 1,091 new cases of COVID-19 to report for the 24-hour period that ended at 8 a.m. this morning. As usual, a full breakdown of the locations of cases as well as areas of interest will be published online tonight on the Ministry of Health's COVID-19 dashboard. So this brings to our a total of we have also had 317 recoveries, which means we have now 15,686 active cases. There have been 20,373 cases since this outbreak started in April, and we recorded 20,443 cases in Fiji since the first case was recorded in March last year, with 4,550 recoveries. The testing update will be published tonight, and you can view that online. Our 7-day average of new cases is now 1,111 cases per day, or 1,256 cases per million population per day. In addition to the cases that were announced, the Permanent Secretary also announced that we have 21 new COVID-19 deaths to report for the period of 14th July to the 20th of July. 2 of the deaths were already detailed by the Permanent Secretary tonight. Both were pregnant women. Of the remaining 19 people who died, their ages range from 36 to 85. The third COVID-19 death to report tonight is a 39-year-old man from Tadirua, who died at home on the 17th of July. He was not vaccinated. The fourth COVID-19 death to report is an 85-year-old woman from Vendongo settlement who died at home on the 16th of July, and she was not vaccinated. The fifth COVID-19 death is a 65-year-old woman from Wangani who died at home on the 18th of July. She received 1 dose of the vaccine in early June. She had not received the second dose of the vaccine. This means she was not fully vaccinated. The sixth COVID death to report is an 81-year-old woman from Tamavo, Iwai, who died at home on the 16th of July. She was not vaccinated. The seventh death to report is a 75-year-old man from Langi housing who died at home on the 17th of July. He was not vaccinated. The eighth COVID-19 death to report is a 70-year-old man from Dautata village who died at home on the 16th of July. He was not vaccinated. The ninth COVID-19 death report is an 85-year-old man from Naitasiri who died at home on the 19th of July. He was not vaccinated. The 10th death is a 69-year-old woman from Wanganake who died at home on the 18th of July. She was not vaccinated. The 11th death is a 48-year-old man from Laudala Bay. He presented to the CWM Hospital Emergency Department in severe respiratory distress. He died on the same day. He had cough, fever, and shortness of breath for 3 days before he presented. He was not vaccinated. The 12th death is a 73-year-old man from Tamavua who died at home on the 18th of July. The 13th death is a 70-year-old man from Cunningham. He presented to the FEMAT Field Hospital in severe respiratory distress, and he died on the same day. He was not vaccinated. The 14th death is a 54-year-old man from Nandawa who died at home on the 19th of July. He was not vaccinated. The 15th death is a 60-year-old woman from Tamavua. She presented to the emergency department of the CWM hospital in severe distress, and she died on the same day. She had received her first dose of the vaccine in mid-June. She had not received the second dose of the vaccine. This means she was not fully vaccinated. The 16th death is a 65-year-old woman from Langi housing. She presented to CWM hospital in severe respiratory distress. Her condition worsened in hospital and she died on the same day. She was not vaccinated. The 17th COVID-19 death is a 36-year-old woman from Tamavua who died at home on the 19th of July. She was not vaccinated. The 18th death is a 66-year-old woman from Bayview Heights who died at home on the 19th of July. She was not vaccinated. The 19th death to report tonight is an 80-year-old woman from Vatuanga. She presented to CWM Hospital in respiratory distress. Her condition worsened in hospital and she died on the same day. She had received a first dose of the vaccine in mid-June, but she had not received a second dose. This means she was not fully vaccinated. So as I mentioned, of the 19 people, of the 21 people who died that we're reporting tonight, their ages range from 32 to 85. This means that while COVID-19 strikes those most vulnerable in our population the most, anyone can be affected by this disease. Out of these 21 people, they were all loved by someone. And by now, we all know someone who has gotten COVID-19. And sadly, there may come a time when we may all know someone, or God forbid, love somebody who dies from COVID-19. We're living in a great time of adversity in our nation, but there is hope if we all work together. We can look to the information about the people who died to get some of that hope. None of the 144 people who died of COVID-19 during this outbreak were fully vaccinated. We now have 2 effective vaccines against COVID-19 in Fiji, and we know that fully vaccinated people have a more than 92% reduction in risk of hospitalization from COVID-19. We also know that now 70% of all adults in Fiji have received the first dose of the vaccine, and over 14% are now fully vaccinated. We also know that most of the people that have been dying from COVID-19 in Fiji have either died at home or within a few days of presenting to a health facility. We know that we have effective treatments in these hospitals that can prevent death even in those with severe disease. So our advice to the public is the same. Please get vaccinated, especially if you're in a high-risk group. If you have asthma, if you have diabetes, if you have high blood pressure, if you have a heart disease or kidney disease, if you're pregnant, please get vaccinated. I'm pregnant and I have asthma, so I made sure that I was vaccinated. I got my second dose a few weeks ago. And also, if you have symptoms of COVID-19, please isolate at home. You prevent the spread of the disease to other people. If you develop severe disease, if you develop severe symptoms, please go to your nearest healthcare facility. And in the Central Division, we've identified 4 healthcare facilities that are specifically designated for the treatment of COVID-19. As I mentioned, this is a great time of adversity in our country. There is hope. We've got this vaccine, we've got effective treatments for COVID-19, but we need all of us to work together so that we can come through this and move on. Thank you.
Bulawanaka, today is day 96 of the current outbreak. And in the Central Division, the Ministry of Health response has changed to a mitigation phase, while it remains in the containment phase in the West, the North, and the Eastern Division of the country. We operate hospital isolation facilities, and we currently have 279 individuals in 6 facilities around the country. 22% of these individuals are either severe or in critical condition. 66 individuals require oxygen, and 2 patients are currently on ventilators. 446 individuals are currently cared for in 14 community isolation facilities in the Central Division, 583 individuals in 9 isolation facilities in the Western Division, and 4 individuals in a single isolation facility in the north. We continue to undertake our screening and contact tracing activity. We have stopped mobile screening for the central division as we go into the mitigation phase. And in the last 24 hours, the majority of the mobile screening was done in the Western Division, where they screened a total of 3,659 individuals and swabbed 511 individuals. Our stationary clinics continue to operate, and in the last 24 hours, a total of 6,049 individuals were screened and 1,770 individuals were swabbed, giving a cumulative total of 336,685 individuals screened and more than 30,000 individuals swabbed to date. As stated by PS, we continue to operate our containment zones in the with the movement restrictions in the central division, such as in Waila and Gauia settlement, as well as in the Western Division, such as the Ndalaisaweni settlement, the Karawi settlement in Ba, and the Vakatora housing in Lautoka. Our community engagement pillar of the IMT is led by the National Disaster Management Office, and many civil servants are currently engaged in raising awareness in the community through education and awareness sessions. They undertake community assessments. They address community needs in water, sanitation, food, and psychosocial support. In health services, our health facilities remain operational throughout the country. Telehealth services continue in the Western and the Central Division, with a toll-free number 165 allowing access to specialist services for diabetes, chronic diseases, the supply of medicines, and mental health care. For clinical services, the changing roles of CWM and the FEMAT Field Hospital is almost complete, where the FEMAT Field Hospital will operate fully as a COVID hospital. The FEMAT Field Hospital currently has 49 admission beds and has recorded to date 175 admissions since the beginning of May this year. We anticipate these numbers to increase as the changeover is completed, and we are also setting up additional community facilities for spillover and off admission cases when the number continues to increase. The Ministry has also set up a home care support system where positive cases who are based at home are regularly followed up through phone calls and interviews. To date, some 402 calls have been made so far, and 1,057 individuals attended to through this forum. As a result of these calls, 70 home visits were later made after the phone interviews were completed. We have also established in the Central Division a centralized ambulance services, and this is based out of the ANZ Stadium in Laudala, that's supporting the patient retrieval system we have established. These services is accessed through the toll-free number 165. We also understand that accessing test results is a challenging area, and our teams are currently working on an information system that will allow individuals who are tested to be able to follow up and get their results electronically through an internet-based system. To conclude, our key messages remain. Please adhere to the COVID-safe measures. Stay at home. Wash your hands. Wear your mask properly. Social distance for 2 meters. They work, and they are important for our effort in stopping this outbreak. We must acknowledge the effort of the media in sharing correct messages on COVID-safe measures the signs and symptoms of COVID-19 disease and promoting vaccination. To reiterate the PS's message this afternoon, if you are positive at home or you are caring for a positive relative at home, know the signs of severe disease, and they are chest pain or heaviness at the chest, shortness of breath or inability to breathe, acute confusion, drowsiness, and the discoloration of skin. When these signs appear, don't wait. Act quickly. Go to the hospital or call 165 for assistance. And finally, get vaccinated as soon as possible. Vinawalevu and good evening.